Bismillahirrahmanirrahim. Assalamu alaikum. Welcome back my YouTube family. Here we are starting series of infectious disease. This is episode 1, part 1. Before we get started, please subscribe my channel. Let's talk about aminoglycosides, in which include gentamicin, topramycin, amikacin, streptomycin. Aminoglycosides are concentration dependent post ABX PEA and extended interval dosing for a gram negative achieve peak while decrease nephrotoxicity plus obviously cost always round increase on mnemogram. Okay, underweight ABW obese AJBW monitor renal function drug level. It can cause nephrotoxicity, hearing loss, impaired balance, nephrotoxicity, ototoxicity, neuromuscular blockade, respiratory paralysis, avoid nephrotoxic agent, avoid neurotoxic agent, and pregnancy can fetal harm, so it is warning. Contraindication: nephrotoxic drugs, amphotericin B, cisplatin, colistamate, cyclosporin, loop diuretic, NSAIDs, contrast dye, tacrolimus, vancomycin. These all are the nephrotoxic drugs. You should avoid these drugs with aminoglycosides or it can lead to damage your kidney, which is very excessively. So peak 5 by 10, trough decrease less than 2. Gentamicin is equal डोज क्या जाएगी 5 मिलीग्राम पर केजी डोज के हिसाब से जाएगी. पीक लेवल मेंशन है 20 to 30. दोनों जेंटा टोब्रा का और एमिकेसिन का लेस देन 5 और जो जेंटा का है वो है लेस देन 2 ट्रॉफ है. Okay, let's talk about oxalidone. Diodones is linezolid, tedizolid, Zyvox and Civextra. The both respective brand available. Oxalidiones bind to 50S ribosomes, converge similar to vancomycin, but also cover vancomycin resistant species. Okay, it can decrease platelets, hemoglobin, blood sugar level, WBCs, and nausea, vomiting, diarrhea, and hypertension must be their side effect. Myelosuppression, thrombocytopenia, and neutropenia. The mechanism of action of linezolid is within 2 weeks. Caution with the serotonergic or adrenergic drugs, and do not shake suspension. And with about tedizolid is neutropenia, less GI and myelosuppression, approved for SSTI. SSTI is skin and soft tissue areas. Infection it will cover these areas. So sulfonamide, sulfamethoxazole plus trimethoprim, Bactrim, Spectra, and Sulfatrim, the brand available. Dose always 5:1 ratio. Sulfamethoxazole 5 and trimethoprim is 1. So 400 by 80, 800 by 160. So here is a caution with warfarin. It can increase INR and calcium, MRSA, UTI, and PCP. Nausea, vomiting, diarrhea, anorexia, skin reaction, photosensitivity, cystinuria, and hypoglycemia, increase potassium, decrease folate, positive Coombs test. Contraindication in pregnancy and breastfeeding women and the person who has sulfur allergy, the most person having a sulfur allergy. So notes: dose based on TMT component SS. स्टैंडर्ड डोज मेंशन है कि 40 बाय कितना 5:1 का रेशो होना चाहिए 480 जो सिंगल डोज है, एंड जो डबल डोज हमारे पास है वो 800/160 अवेलेबल है. सो uncomplicated UTI, 1 tablet BD for 3 days. If you having uncomplicated UTIs, so you can use 1 dose tablet. DS any double dose tablet, it's 800/160 for BD, twice daily for 3 days. Vancomycin brand available, systemic 15 to 20 mg per kg dose, IV Q8 to 12 hour, the gap in 8 to 12 hour. BD भी दे सकते हैं और TDS भी दे सकते हैं. ओके एंड इसकी जो है वो लोडिंग डोज जाती है व्हेन आई हैव बीन प्रैक्टिसिंग इन हॉस्पिटल. सो 2000 हम जो है वो पहले इसकी जो है वो लोडिंग डोज देते हैं, देन जो भी हमारा एमजी चलाना होता है हम उसको कैरी करते हैं. सी डिफेलिश अगर 125 से 500 mg ओरल QID मल्टीप्लाई बाय 10 to 14 days. ओबियसली अब मोस्टली जो है वो क्या नाम है उसका ओरल, अच्छा इसकी ओरल फॉर्म ऐसे कभी मार्केट में अवेलेबल नहीं है, बट हम इसके इंजेक्शन को ही डाइल्यूट करके देते हैं. सो 10 to 14 days तक देने. इनिबिट सेल वॉल डी एनालाइन डोलानीन ओरल, नॉट फॉर सिस्टमिक इन्फेक्शन के लिए ओरल हम नहीं देंगे अगर सिस्टमिक इन्फेक्शन है. फर्स्ट लाइन है मार्सा के लिए, कंसिडर अल्टरनेटिव इफ मार्सा मिक 2 और लेस देन मोर देन 2. ओके. Abdominal pain, nausea, myelosuppression, CGS and TAN as the ADRs, photosensitivity as usual, burning, nephrotoxicity, ototoxicity, infusion, red man syndrome, monitor renal function, trough at SS, single dose, and गोल जो ट्रफ है वो 15 to 20 है. निमोनिया, एंडोकार्डाइटिस, ऑस्टियोमाइलिटिस, मेनिंजाइटिस, सेप्सिस. गोल जो ट्रफ एनी अदर इन्फेक्शन में जो गोल है वो 10 to 15 है, जिनमें 15 to 20 है निमोनिया, एंडोकार्डाइटिस, ऑस्टियोमाइलिटिस, मेनिंजाइटिस, सेप्सिस. डेप्टोमाइसिन, क्यूबिसिन कंसंट्रेशन डिपेंडेंट है, कवर्स मार्सा and vancomycin resistant species do not used in history of pneumonia. Okay, can increase CPK level is a protein present in blood. Myopathy, rhabdomyolysis muscles and the tendon muscles falls increase PT and INR. Monitor CPK level weekly because it can increase it. And competitive with normal saline, no dextrose. So it is must be recommended normal saline. We will dilute in normal saline, not in dextrose. Let's talk about lipoglycopeptides. These basically are concentration dependent. It include telavancin, oritavencin, and dalbavancin. Telavancin, Vibativ, oritavencin, Orbactiv, and dalbavancin is Dalvance. Telavancin had metallic taste. I think there's a few drugs which have metallic taste, and telavancin is one of them, so you need to remember this. And Redman syndrome infusion can occur. And there's few drugs as well which can cause Redman syndrome. You also need to remember this. So these oritavencin and dalbavancin then both can cause Redman syndrome, and it can also occur with using aspirin, I think, if you remember. So the fatal risk, nephrotoxicity, mortality increase, QT prolongation, false increase in PT-INR, Redman syndrome, and IV over same. Redman syndrome एक और था, I think vancomycin, it can also lead to Redman syndrome, and it is a kind of infection, or I mean sorry, it's a kind of reddish and or patches on your skin. It's got a hypersensitivity reaction, and but not just skin, it's from its internal organ too also get affected with this. So this kind of infection, I mean syndrome related to infusion rate. So your infusion rate must be 60 or less than 60, not more than 60. So it can lead to, otherwise it can lead to Redman syndrome. And the other two drug is oritavencin, dalbavancin, false increase in PT-INR up to 12 hours, and the other one is 120 hours. Oritavencin IV use of heparin 120 per hour interface with APTT. Okay. Extreme long half-life single dose regime. Oritavencin having extreme long half-life, and dalbavancin, as you can see, it's 120 hours. So you need to adjust a dose, and the drugs who have very long half-life, we try to give them in as a single dose. practice these kind of drugs in BD. So here are the last slide of our episode 3, infectious disease. Step 2, Gramine. These include quinoprestin and dalfopristin, sinurid, bind 250S ribosome, not active, E. faecalis, not well tolerated, used in limited to vancomycin resistant infection. Arthralgia, myalgia, infusion, reaction, phlebitis, edema, pain, hyperbilirubinemia, CPK increase, their ADRs, and tigecycline if you are the patient if suffering with a severe disease like a cystic shock and hospital is from several months or several days. So first we move on Vanco, then Linzo, and then this is the kind of the last drug we give patient or administer them. And in hospital practice, when these kind of drug I have preparing for the patient, so I know I have idea that the patient is no longer to survive, because this is the last line we choose for their treatment. Okay, so related to tetracycline, avoid use in blood infection. Reconstitute is yellow, orange color. Discard if not this color. So remember this yellow and orange color. I have practically seen this. Nausea, vomiting, and diarrhea. And the thing is that not used in blood infection. So this is not for blood infection, and it increased the death rate. Maybe the patient maybe died for due to this. No renal adjustment. No activity, 3P Pseudomonas, Proteus, and Providentia. So no renal adjustment. This is a good thing. We are missing this drug to those who have renal issues. So this is safe here. And no activity vs 3Ps यानी Pseudomonas, Proteus, Providentia. इनके खिलाफ इसकी कोई activity नहीं है. Okay, next, and we also give this colistin, which is colimycin M available brand. We have colistin available brand. So it is colistin. Okay, mostly जो drugs होती हैं वो mg माइक्रोग्राम में आ रही होती है, लेकिन ये drugs millions में आती है. इसके जो यूनिट्स होते हैं वो इसी तरह काउंट होते हैं 3 मिलियन 1 मिलियन. तो डोज इसकी वही जाती है. लोडिंग डोज सबसे पहले हम 9 मिलियन की दे देते हैं पेशेंट को. फिर बीडी के हिसाब से जिस तरह पेशेंट उनके अकॉर्डिंग रिक्वायरमेंट होती है हम इसको 3 मिलियन 1 मिलियन जो है इस तरह देते रहते हैं. सो पॉलीमैक्सिन IUC MIC dependent main use MDR gram negative infection, always used in combo with other antibiotics. So nephrotoxicity, dose dependent neurologic disturbance, dose carefully. Inhalation solution must be mixed first. So inhalation solution must be mixed first. आपने सबसे पहले solution को जो है वो mixed कर लेना है, and dose बहुत carefully देनी है. As I told you, इसका जो jar होता है वो इस तरीके से होता है. Polymyxin B sulfate, the same polymyxin के बारे में I think ये लिखा हुआ था कि dependent होती है, negative always in combo use होती है, और nephrotoxicity होगी, dose dependent होगी. Okay. सो कॉलिस्टिमेट का बता दिया आपको, ये मिलियंस में होती है. इसके अंदर तकरीबन हम 1 मिलियन को 33 कुछ काउंट करते हैं. ठीक है, 33 या 32 पॉइंट समथिंग काउंट करते हैं अगर हमें एमजी में डोज निकालनी होती है. सो क्लिंडामाइसिन, क्लियोसिन, लिंकोसमाइड, नोजिया, वॉमिटिंग, डायरिया, रैश, कोलिस्टाइटिस, सी डिफेलिस, CJS 10 स्किन रिएक्शन एंड सेलुलर सेंसिटिव. डी टेस्ट फॉर स्टैफ ऑरियस के लिए हम डी टेस्ट करवाते हैं. मेट्रोनिडाजोल, फ्लैजिल, टेनिडाजोल, टेनिडामैक्स. हेलिकल DNA स्ट्रक्चर used for anaerobes, protozoal infection, vaginosis, trichomonas, C. difficile. Metallic taste. Okay, so is there another drug which is tinidazole, which having metallic, because we all have taken metronidazole. I never find its taste metallic. So this is tinidazole. Rash, dark urine, furry tongue is because of tinidazole. So this is okay. The tinidazole is carcinogenic. Pregnancy, breastfeeding. Flagyl is safe in pregnancy. So breastfeeding and contraindication, which is about tinidazole. So alcohol use 3 days after DC। सो प्रोपाइलिन ग्लाइकोल प्रोडक्ट 3 डेज बाद आपने यूज़ करने हैं। डायसल्फराम रिएक्शन हो सकता है, स्टमक क्रैम्प, nausea, vomiting. अच्छा, disulfiram reaction is a kind of reaction which is the name, proper name is called disulfiram reaction, क्योंकि मोस्टली ये रिएक्शन डायसल्फराम से यूज़ होता है जब हम अल्कोहलिक पेशेंट्स होते हैं। तो इसमें भी ये चीज़ आ जाती है, स्टमक क्रैम्प, nausea, vomiting, headache and flushing. These are the sign of the disulfiram reaction. माइल्ड टू मॉडरेट सी डिफेलिश में जाता है अगर आपको इन्फेक्शन है, जो कि वी ऑल नो के 500 IV ओरल TD जा रही होती है फ्लैजिल एंड मल्टीप्लाई बाय 10 to 14 days. And other drugs is pyroxamycin, difisir, rifampicin, ciprofloxacin, fosfomycin. ये UTIs में मोस्टली जा रही होती है। नाइट्रोफेंटाइन, ये भी जो है वो UTI वगैरह के इन्फेक्शन में जो है वो जा रही होती है। Mupirocin nasal, which is Bactroban nasal. These are the any other drugs. And rifampicin भी UTI में भी जारी होती है, कॉम्प्लिकेटेड और नॉन कॉम्प्लिकेटेड। एंड इसके अलावा जो है ये क्या कहते हैं GI इन्फेक्शन में भी जा रही होती है। एंड फॉस्फोमाइसिन लंग्स वगैरह में भी जा रही होती है। अभी कोविड में मोस्टली जो है वो फॉस्फोमाइसिन जा रही थी। सो दीज ऑल आर अबाउट इन्फेक्शियस डिजीज. Thanks for watching. If you like this video, please subscribe, like and share my video. Also mention your any queries related to pharmacy in comment section. Allah Hafiz. Until next time.